very important topic and link between diabetes and the mouth. I see a wide range of patients, but I do see a lot of patients who are diabetic, in particularly patients from the Indian and Pakistani origin. So it seems to be more prevalent in us. Now, diabetes, we all know the different types. I don't need to go into that again. I'm not talking about the medical side. I'm doing more of a talk on how it affects our mouth and our then following from the mouth to our body. So patients with poorly controlled diabetes are at a greater risk of dental problems because of the increase in blood glucose levels. Now, these problems, the most common problem, unfortunately, is gum disease, and this affects about 22% of diabetics. Now, I see this all day long. So it ranges from the early signs of gum disease, which are gingivitis. Now, patients may feel that when they're brushing their teeth, the gums are a little bit sore. Gums are maybe a little bit more puffy. They should be light pink, but they start to get a bit darker when they're inflamed. And eventually, unfortunately, that progresses from gingivitis, which is reversible, onto periodontitis. Now, that's a more severe form of gum disease, and that's when it starts to get too late. This is when patients start to lose a bit of bone and gum soft tissue around the teeth, and the teeth unfortunately start to become loose, and patients may find that they're getting gaps between the teeth that they didn't have before. That's a very, very common, where the top teeth start to splay out and we start to see changes that weren't there before. Now, a lot of patients cope well with loose teeth. They don't tend to have any problems, but when I go have a look, I have to tell them, look, there's a problem. And if we don't treat the disease right now, then we may lose teeth sooner than we should. Another problem patients with diabetes may have is they may have a bad breath. Now, unfortunately, when we're the person with the bad breath, we don't know it. So it may be family members or friends that may notice it. And unfortunately, it's one of those things that even I find difficult to tell a patient. So that's something that obviously we don't want to have. The other complication is because diabetics tend to heal a bit poorer than other patients, they have delayed healing. They could get further infections such as abscesses from the gums, from gum disease. Now, this, if the face swells up, that could mean patients can't eat very well. And then if you're not eating very well as a diabetic, that affects your blood glucose levels. So we don't want things like that happening. The other problem that we could get is a lot of patients who are diabetic tend to have dry mouth. And this can give rise to oral thrush. And this can be transferred to other people as well, but it's not uncommon. A lot of diabetic patients that I see also have high blood pressure and are on multiple medications. And as we know, all these medications have a side effect. And unfortunately, a very common side effect is dry mouth. When our mouth is dry, we don't have a lot of saliva. Saliva is what buffers and protects the teeth from forming cavities, because we have bacteria in the mouth all the time. When our mouth is dry, we're more susceptible to getting holes in the teeth. If these holes are small, sometimes patient may not experience any pain, but unfortunately, over time, it only progresses, and then patients may suffer from an abscess from this type of disease or severe toothache. So as we discussed before, diabetics have poor wound healing. So again, if we're taking teeth out for a patient, then taking 1 or 2 teeth out for a diabetic patient is not a big problem, but they may find that healing takes a little bit longer than a healthy patient who's not diabetic. Well-controlled diabetics is easier, but if the diabetes is not very well controlled, then we do find slight delays in the healing there. Now, the management, as we all know, ideally want to be brushing. Everyone should be brushing twice a day, ideally with an electric toothbrush. But the most important thing for the gums is to be making sure we're flossing and using small brushes that go between the teeth, such as TP brushes, just to remove as much bacteria as possible from between the teeth. You can use, there's Corsidil mouthwash, but patients should not make the mistake of using regular Corsidil every day, because it should not be used for longer than a month. Otherwise, it can cause permanent staining on the teeth, and it can cause a permanent bad taste on the tongue. Instead, if the dentist has advised to use Corsadil, then there's Corsadil Daily, which is a mouthwash, and there's Corsadil Daily toothpaste. That version is safe to use every day going forward. The other main thing is make sure you're going to see a dentist every 6 months or more often if the dentist advises so. And then the dentist will do a prescription for the hygienist to say maybe see the hygienist every 3 weeks, every 4 months, or then if it's well controlled, every 6 months. So it's good to get an idea from your dentist how often you should attend the hygienist. The hygienist cleans up any tartar buildup that will not come off with a toothbrush. When diabetic patients come to me, I would advise that you come to have treatment 2 hours within 2 hours of having your breakfast and medication, because we don't want you skipping meals and going hypoglycemic. So ideally, early morning appointments tend to be favorable for diabetic patients. And I just wanted to say that periodontal disease is, like we said before, worse when the gums are bad. It affects the diabetes, and when the blood glucose level is high, it affects the gum condition. So it's both interrelated to each other. And having gum disease can also lead to more serious problems such as heart disease. So ideally, the cleaner we can keep the mouth free of disease, the better for our general health as well. And remember, if you've got gum disease that's not very well controlled, then that means you can't have implants and you can't have bridges or any orthodontic treatment. So it's going to be dentures. So ideally, we want to avoid that as much as possible. And that's it.